Good afternoon, everybody. This is Steve Wilson at the Illinois State Water Survey. We're going to start our presentation on what environmental health professionals need to know about wells. And mention quickly, this program is sponsored, funded, and supported by the Rural Community Assistance Partnership through a grant from US EPA. And we're at the University of Illinois, both the State Water Survey and the Illinois Water Resources Center together have developed a private well class in this program. Thanks for attending, and if you have questions as we move through, you can put those in the question box or the chat box. We'll answer all those at the end, and we'll take a few minutes. We share Google Doc between us, and we'll take a couple-minute break to put those up on screen and then try to go through them as we go, at the end. So, again, this is part of a national program. We are recording this, and it will be available on our website. We actually revamped our website, and I'll show you that at the end. But there's a webinar and events page, and like the recording we did last month for private well owners is there and it's recorded, as well as this will be. So, again, time at the end for questions. I'm Steve Wilson. I'm a groundwater hydrologist, and here at the Water Survey, I have Dan Webb and Chuck Curtis. They're both chemists here, and when we get to the end, especially water quality-related questions, they're your men to answer those things. And also with us, actually Jennifer Wilson is not with us today, but Katie Hollenbeck from the Water Resources Center. She'll be keeping track of your questions as they come up and assisting with those things during the webinar. So we're going to talk about these things today. Really, this webinar is the first time we've done one that's really meant for environmental health professionals. And so it's going to be a little different structure, more about challenges and issues we face as professionals who work with well owners, and then some issues about well owners and the attitudes they have towards their well, a little basics about groundwater and wells, and I'll explain that at the very end when I get to the gap on groundwater health professionals. One thing I've learned, I've been working here for over 30 years, is that there's really a difference in the approach that people take when looking at wells from the standpoint of groundwater, understanding hydrology, water flow, all those sorts of things, like I do traditionally, versus the health professional side that looks at things from the water quality and public health risk side. And there's really a lot of room for both of us to learn from each other and develop better relationships, I think. And so I'm just going to mention that at the end. And then, more about our program, what we've added. There's some really nice things that we've done here recently to provide more resources for environmental health professionals and others working with well owners. So, issues. It's more than just public health protection, although that's probably the main focus for most of us. We want to make sure that people who are drinking water from wells, since they're not regulated, like a community water supply, are actually being protected, or at least they're informed enough to know what to do to protect themselves. There are also issues, though, related to source water protection. Things you do around your well may affect your well, but it could also affect your neighbor's well or the aquifer in general, and then just understanding general water quality. And those are the three things that kind of get, the broad base issues that we deal with. But there's also a lot of issues that, make headlines and show up in the news, especially drought like in California. They're suffering through such a long drought. I know Katie just posted on our Facebook page something about this county they're actually moving people and helping them rent homes where they might have water. Flooding issues and what that does to wells. This is a well in central Illinois that's right along a small creek, and they've actually done what I would consider the right thing by, this is about 12 feet tall, and so it's sealed all the way up to the 12 feet above ground, and you obviously need a ladder or a tall truck to do any maintenance on this well, but it's above the 100-year floodplain, so that, in theory, it's protected and wouldn't be overtopped if there is a flood for this small watershed. Contamination issues, obviously, things like Flint are in the news. That's really a distribution and issue with the way the water's being treated. There's natural contamination that we hear about. Arsenic's kind of one of the big poster elements, if you will, around the country, just because arsenic's so common in the Earth's crust, and there's a lot of places in the country where it shows up. And then the whole issue of private wells being not regulated. And, there's a lot of arguments both ways there. Some folks feel that private wells should be regulated and people should have to test. A lot of private well owners want the government to leave them alone, and they feel they have the wherewithal to do that. Where there's a lot of arguments, as I said, on both sides of that issue, and we probably won't get into that. So what are our challenges? Well, running this program nationally, one of the things that we've found is, there's so many different definitions, and the way the rules are implemented are so different in different states. Even on what is a private well and what are the well construction codes and what's acceptable and not acceptable. In one state, it may be completely fine. In another, it's not accepted that way. Permitting and well log submittal, most states have those rules, not every state. And those rules have changed over time, especially construction codes, where in Illinois we passed a law in the early 60s that said you had to file a permit with your county health department and you have to file a log, which, the water survey where I work, all the counties submit those copies of those logs to us, so we have a room with 500,000 or 600,000 well logs, which is really nice for the work that I do. But in other states like Mississippi, their law today still says that if you put in a well that's 5 inches in diameter or less, you don't have to file a log. And what that's translated to is there's really, in Mississippi, in most counties, they have no idea how many private wells there might be in those areas. I mentioned New Jersey and Pennsylvania here. New Jersey passed a law about 15 to 20 years ago that requires the state to come out and collect a water sample whenever any property's changed hands that has a well. And so by doing so, there's considered, quote, a research quality sample that's collected, and it costs, at the time it was $600. I'm not sure what it is today. But by doing so, the state has data on private wells from about 13,000 private wells every year. And so, over 20 years, that's 260,000 water quality samples that they can use to better understand the water quality in their aquifers, issues with certain types of wells, all those sorts of things. And on the opposite side, Pennsylvania, there are no rules, no construction code that are required by law. There's recommended code. And one interesting thing about Pennsylvania is what that has caused is a lot of county and educational groups have got involved and tried to educate the folks in Pennsylvania because of the lack of state statute to help protect and ensure that wells are constructed properly. So we also have issues of enforcing those rules. I've worked in some states in the Midwest besides Illinois where, the state doesn't enforce filing logs. So even though they have a law that says you will file a log with the state, when you go to, if I go out and do a field study where I've listed a bunch of private wells in a given area and I go to find the logs on the state website for that, they might have 10% or 5% of those logs because the drillers don't file them and the state doesn't do anything about it. So it's really disparate how things are, and also because there's a lot of counties that have requirements for septic but not necessarily private wells. So a lot of times the county isn't really equipped adequately or trained to deal with private well issues, and it really depends on the state where you're at, and some they're much more prepared than others. The folks that I work with in Illinois, all the county health departments inspect wells. They all seem to have the wherewithal to do the job they need to do. But I know I've worked with some in other states where that's just not the case. So, and from a national perspective, one of the biggest challenges is how unorganized and how different the approach to support for private well owners is from state to state. In a few states like Pennsylvania, Texas, Rhode Island, Virginia, there's probably a couple I'm missing, Extension has created a state program where they have a well owner network, or they train folks to go out and help other well owners, where in many states that mechanism statewide doesn't exist. And so it's very disorganized. Our goal, I think, is to raise awareness of private well issues. And so to do so, we're trying to develop a more consistent approach to those things and make sure everybody's aware of what other folks do or don't know. So to me, this is the heart of the problem with private wells, these three things: poor well construction, abandoned wells, and well owner lack of knowledge and education. So many folks believe, I'll start at the bottom, So many folks believe that their well is safe because it's groundwater. Groundwater is safe, it's protected, with no understanding of, the two examples of pictures here are both hand-dug wells, brick-lined. You can see the one with the brick out on the bottom had a frog in the well. We're doing some measurements of water quality at the time and for a study. So not understanding that protecting your well at the surface, and some of the issues with well construction code and not meeting code and wells that are grandfathered in. I grew up on a dug well, very similar to these, and my dad always swore that our water was better than city water because it didn't have chemicals in it. And, again, not understanding the risks we had because we're getting our water from a shallow water table, not to mention that it was in the middle of a cow pasture, and it was in the center of a small ravine with cornfields on both sides. So, it probably wasn't. I don't know if there's any lasting effects from that, but that's what I grew up on. The other issue is abandoned wells here in the middle. For every well that's out there, there's probably one or two abandoned wells that no one knows about. I'll get into that a little bit later, but it's really a huge problem. There's probably at least 1 million abandoned wells that are improperly abandoned, just unused, and both a safety risk and a health risk in Illinois alone. And again, poor construction. Wells are always grandfathered in when the construction code changes. It's only for new construction. And so there's a lot of wells that either have construction that wouldn't meet code today or using equipment that's not really suitable for today, like an old piston pump, things like that. And what we find, at least in Illinois, is many times a lot of the issues are related to these three things. So a little bit about well owners to start with and why they're unique. Really, they come from every social, economic, and educational class. And so what that means is you're looking at the entire population. You can have someone who's been the fourth generation on an old family farm with a dug well that was hand dug in 1930 to someone who just moved from a large city, decided to buy a house in the country, has no idea what to do with a private well. And so you've got, it's just a huge range. And I grew up in a very rural area. We also have, for those of you familiar with Cook County, Illinois, that's the county that's Chicago proper. There's over 3,000 private wells in Cook County that are in use today, and that's because all the municipal boundaries for all the suburbs up there don't always match up and line up. In any of those unincorporated areas in between, there's small pockets of subdivisions where they have private wells. And so you've got a completely urban setting with highways and industry and everything else, and you've got these private wells that are in use versus, again, where I grew up, I think there's either one or two wells in my entire section, mile square. There's two houses. So they come from all shapes and sizes, and it makes it more difficult, one, to reach them because you have the entire gamut. It's not like you're looking at one particular audience to try to reach. This is a study that was done by the University of Minnesota Extension and UW-Madison and at MSU. So they sent out, and this is really relevant because it's one of the largest studies, what might be the largest study I've ever come across. And unfortunately, this never got published in a journal or a paper. This was given as a poster at an extension conference, and it was also a PowerPoint. And we were fortunate enough to get a hold of this. But they did this huge study where they sent out about 2,700 questionnaires to 6 counties, 2 in each state. And you can see here in Wisconsin, they gave a $2 bill and a free test. In Minnesota, a $2 bill. And in Michigan, just a coupon for a free test. And you can see how that affected the return rate. But in the end, they had 1,733 responses. So when they asked people how worried they were, 87% said they were only slightly or not worried at all about their untreated well water. And that's fine, except that there's no data to back up why they feel that way. Most had not tested. And so over here on the right, they were given a laundry list of reasons for anyone who hadn't tested their water, which was about 1,100 of the 1,733. And you can see 53% said, we've been drinking it for years. And, what that lends to is in just an understanding that, they're only looking at it from the acute standpoint. No one's getting sick. It doesn't address things like arsenic or anything else that might be a long-term, chronic problem or lead, any of those things. And so if we get into the details here, it really comes down to me to two issues. One, they just don't understand what they need to do. They didn't understand they should test or how to test or what they should test for, and that's an education problem on our part. We need to get more information out there and help those well owners understand that it's best for them to test annually and just to ensure that their well is safe. Or they don't believe that there's a problem. So we've been drinking it for years, it's probably fine. 8% said they don't want to know. And I tell this story every so often, but we went out and did a study of some rural subdivisions where there was a lot of arsenic in Illinois. And we went to this one subdivision with 22 houses, and we wanted to sample all of them because we were looking at spatial variability of arsenic. And this one guy said, you can sample my well if you don't send me results and you do it when I'm not home. And basically, I don't want to know. And so I had to know what he wanted, why. And it's because he's trying to sell his home. And in Illinois, the law says there's a form you have to fill out whenever you're selling a home with and one of the questions, which is legally binding, is do you know of anything adversely about your well or your water quality? And he wanted to be able to honestly answer that no. So he just chose not to know. Not a great situation, and it just leads to some of the issues you have. More information, it can lead to other problems, like a drop in property values. So they're all really important issues that need to be addressed, and they're all considerations we should all have. So as far as why they're hard to reach, and I guess I didn't explain that very well, but a lot of times well owners, we can't reach them. They don't participate. You can have a free sampling event. You can have a workshop where everything's free, or you're going to do a test for them and advertise the heck out of it, and you still don't get people to show up. And again, it's because people believe their water's safe, or for some, it's the cost or just human nature. Why don't people go to the dentist when they should? I'll be fine. I don't see an issue. And so it's that lack of understanding, and there's other things here. A lot of in rural areas being independent. I know where I grew up, you never heard anyone talk about their well being a problem. Never once. Only that it's great to have well water, better than city water. And so it's that lack of understanding or just not trusting the government. If you're with an agency that actually is considered government, it causes those issues. A little bit about aquifers and wells. So what we really need to understand, especially if you're like at a county health department, is your geology and the types of wells you might have in your area. So the geology dictates what kind of wells you might have, how deep those wells are. It's really just what you happen to have in your area. You can be in a county that's right along a major river valley or in a river valley, and it's all sand and gravel, versus on some upland where it's glacial till and there's no real aquifer, so there's a lot of large diameter dug or bored wells. Or you might be somewhere off the glacial margin of the United States, and it's in an area where you have rock at the surface. And so all those things matter. Different types of rock have different types of naturally occurring contaminants, and so it's understanding what the geology in your area means and working with someone who can explain that'll take you a long way in understanding what you need to tell well owners and what things they should test for, or you should test for if you're not already aware. And I realize when putting this together, it's a little difficult because we have some environmental health professionals who probably know more than a lot more than I do about some of these issues, and others who are pretty new at the game and may not. So trying to create a balance here. As far as aquifers go, in some cases you have choices. In Illinois, we're very blessed. We have plenty of water in most places. I'll show a cross-section near the end. There's places where there's 5 or 6 aquifers to choose from if you drill a well. It just depends on how deep you decide to finish it. And in other cases, you only have 1 or none. And so understanding those differences and what it means to be in different areas. For instance, in Wisconsin, there's one bedrock layer or aquifer that has arsenic at over 1,000 ppb. And so the state legislatures come in and legislated that when you drill a well, you can either finish the well above that unit, or if you go below that unit into a deeper aquifer, which might be great water, you've got to case off that unit where the high arsenic is. And so understanding those issues is obviously important. So Quickly about types of wells. Bored or dug wells are large diameter. They're usually put in areas where there is no aquifer, so you're getting water from the water table. So they're typically less than 60 or 80 feet. Sometimes, the well I grew up on was only 14 feet deep. You can see underneath this drill rig, there's a large hole there. It's a 3-foot diameter borehole. They'll put concrete tile, vertical tile in that, 4-foot sections, and it's the seams where those two sections come together. They don't cement that where the water can seep in. So it's all from near the surface. And to me, this is like bean stubble. I'm pretty sure it is. And it's ironic to me that there must be a house nearby here, or maybe they're even up on a roof taking this picture, but they're putting a shallow well in a soybean field, which is probably in corn and soybeans most of the time, where they use herbicides and nitrate. And I find that ironic, but that's the way this particular picture is. Here's some examples. You can't necessarily tell by the way they look at the surface. The one in the upper left is an old hand-dug well where they've got 2x6s and 2x8s and 10 and covering it. It's in a cow pasture. There's a cornfield right above it, upslope. Every time there's a big rainstorm, you can see the mud around this where the cattle have come along and rubbed on the posts. It doesn't seem like an ideal place to have your well and have water seeping in your well shallow. More of a approved construction on the right is the 3-foot casing I mentioned all the way to the surface. And now, at least in Illinois, they've changed the law, and you can't bring the 3-foot wide casing up to the surface. You have to have 10 feet of solid pipe and earth fill in the upper 10 feet to provide some protection from surface infiltration. And so that's the lower left picture here. It looks just like a drilled well or a sand and gravel or bedrock well with a red monitor cap. And in effect, that's actually a large diameter well when you get down to 10 feet. Here's what they look like. You can see most of the time, again, these are areas where there is no real aquifer. So you can see in the bottom in the middle it says sand lens. This might be 2 inches of sand or 4 inches of sand. It's not very extensive. It's mostly glacial till. And so in those areas, you can see the seams every 4 feet. And the reason you have a large diameter well in the first place is it's meant to be kind of like a cistern. It stores water. So it seeps in slowly so you can use it. I know our well, it was 4-foot diameter and only 14 feet deep. If I left a hose on for our livestock, we had horses, and if I left the hose in the tank and forgot about it, our well would run dry and we wouldn't have water during the summer for a couple of days. And then when the water started seeping back in, it'd be muddy. And so not a good situation and not necessarily protective of public health. Sand and gravel wells use a screen. So the reason you have this woven screen, this is a stainless steel screen in the picture, is it's sized so that the water can go through but the sand doesn't. You also put a gravel pack, it's called, around it. It's actually a sand pack that's specifically sized to help keep finer sand from getting through the screen. And so by putting a well in the sand and using the screen, usually you can produce a lot of water. Most irrigation wells and higher producing wells are this way. And so typically if you have a very thick sand that's saturated, you can get a pretty good water supply here. And the problem becomes, if it's shallow. And then especially if you have a sandy soil at the surface, then you're at risk of surface infiltration and, water can flow easily through sand and get to a well. So this is a typical log from Illinois. You can see there's 4 feet of topsoil, number 18 here on the bottom right, and then it's sand and gravel it's 41 feet thick. So basically there's 4 feet of topsoil and then it's sand. And so the issue here, though, is if you look at the casing and liner pipe, it's 5 inches of galvanized pipe to 41 feet and then a 4-foot screen. So it says the screen diameter is 4 inches, it's 4-foot length, and it's at the bottom. So the water is actually only coming in the well from 41 to 45 feet. Not up at 4 feet, none of those things. Whereas if this well were screened over the entire length, then water could come in. So at least in this case, even though it's sandy all the way down, water has to travel 40 feet from the surface through sand, which is a good natural filter, before it gets in the well. So there's a little protection from surface infiltration and some of those things. If we contrast that with a bedrock well, typically a bedrock well only has casing to a certain depth within the bedrock. in this example, and this is from Maine, it shows on the right, it says 10 to 20 feet of casing into bedrock. Most of the time you case through the unconsolidated material, which it says here saturated overburden, which is unconsolidated clay, sand, silt, those kind of deposits, and then you seat the well 10 to 20 feet into bedrock. At that point, you drill a borehole. It could be 400 feet deep, it could be 1,000 feet deep, but your casing might only be 60 feet deep. So from that point on, it's an open hole. And if the rock is sturdy enough, which is the reason you would be able to do this, if it wasn't, if it was very friable or a sandstone or something like that, you might have to have casing further down. But the rest, let's say, for example, it's 400 feet deep and the casing's only 60 feet total from the land surface. That means the bottom 340 of that is an open hole. And the reason you do that is because most of the water in a bedrock well comes from fractures in the rock. And you can see those blue lines on this. These are cracks in the rock formation itself. And the more fractures you hit, the more water supply you're going to have. And that's why things like granite, which is a very poor aquifer and only has a porosity of 1 to 3%, that means there's very few cracks in it. And so unless you hit a number of those cracks where there might be water stored, you're not going to have much water supply. Whereas if you hit a lot of fractures or large fractures, there's areas where you're using bedrock wells to irrigate center pivot irrigation for corn and soybeans that might pump 1,500 to 2,000 gallons a minute. So, yeah, it makes a big difference. One thing I forgot to mention, because it uses water mostly from these fractures, then it means water can come from further away. You can look at it like conduit or a pipe that's going directly to the well. And it may be a small fracture that, like in the example here, they're leaning up towards the surface into the saturated overburden. There's a crack all the way to that. Well, now you're having water seep into that crack and getting into your well from a much shallower depth. And so sometimes, not all the time, bedrock wells can be more susceptible because they have fractures that run to the surface, or they have fractures that are close to some other source, and water can come from farther away, so to speak. And here's a bedrock log, again, from Illinois, since that's where I'm at. You can see here, if you look at number 18 at the bottom right, it says there's sand and boulders from 175 to 187, then broken limestone. So that's the interface. The overburden is the sand and the clay and the gravel that's up there. And then broken limestone, usually right at the surface, it's more friable and fractured. And as you go down into the bedrock, it gets more firm and hard. And so they went through 68 feet of bedrock line,stone, and then they hit shale, so they stopped. Shale is basically a cemented clay. It's not an aquifer, it's an aquitard, and it doesn't provide any water to a well. And so the water's coming from the bedrock, the limestone here from 189 to 257. And then if you look up at number 15 here, and 14 and 15, for 14 there's no screen, and it's black steel casing down to 199. And at that point, so I guess I should explain this. They use PVC to 179, which is still in the sand and gravel, the unconsolidated material. And then they put 20 feet of black steel from 179 to 199 and seated that in the bedrock. And below 199, that's an open hole. So it looks like they put in a 5-inch diameter hole with the drill rig. And so there's a 5-inch hole going down to 260. And so understanding these logs or finding logs for a particular well obviously can give you a lot of information. Here it even talks about the pumping level and the static level. The water level in this well is 130 feet below land surface, which means when they punched a hole in the bedrock and finished a well there, the water level rose above the rock up into the well, all the way up into where like the red clay and the would be. And that means it's artesian. It's got pressure on the system, and then when they pumped it at 25 gallons a minute for 2 hours, it only dropped 30 feet. So it's a pretty good well, much more than a home would need. So going back to well construction, construction codes have changed. I know if you're in Pennsylvania, again, or Alaska, there are no construction codes, but in most states there are, and because existing wells are grandfathered in, and before the advent of the pitless adapter, many wells were put in pits in colder climates so that pipes didn't freeze. There's all these issues about poor construction that end up leading to especially a lot of bacterial contamination because wells just aren't protected well enough at the surface, or they're allowed to be exposed to flooding or, a pit full of water, those sorts of things. So not only is there an opportunity for surface contamination, but especially in the case of pits or old hand-dug wells, they're a safety hazard. And just as an example, this is from the Washington State Department of Ecology. They have a blog. It's worth subscribing to, and they show these pictures every so often. But there's a piece of plywood. This is the picture on the left. There's the jet pump, the blue pump. There was a piece of plywood over that entire well with a nice big hole in it. The woman's probably stepped on that plywood 1,000 times in her life. That time it broke, and it killed her. And it's not protected. You can see there's stuff laying around that can fall in the well. That ends up, in her drinking water. And so this is certainly not a protected well. And the picture on the right is meant for shock value. It's an old hand-dug well that's down in southern Illinois. I have pictures of this well from 1 year Don Kelderman took, where it just shows this nice hand-dug well. There's a piece of tile on the top of it now, but it's still exposed at the surface. And the next year he came back, and that's a goat. And there's a goat farm about a half mile away. So a goat wandered off, managed to find its way and get in here. And yeah, it's what's the problem with poor construction and not sealing wells, and leads to groundwater contamination as well. So what should you do with these wells? Bring them up to code. We tell people we're actually developing this assessment tool that we're going to use to go around and help well owners understand their vulnerability and what things might be a risk, if they're in a floodplain or some of those things. One of the recommendations that'll be in that is if you have a pit still or using an old type of well, bring it up to the current code. Extend the pipe to the surface, fill that area of clay grout. If you need to install a pitless, do so. Find out, talk to your county health department, do what you need to make sure that if you protect your well at the surface, you've eliminated, in my opinion, probably 95% of chance of contamination issues in your well from the surface. And that's really where a lot of the problem is. Abandoned wells, same thing. Well logs weren't required until the 60s in Illinois or later. As I mentioned, in Mississippi, you still don't have to file a log if your well's 5 inches in diameter or less, which is most private wells. In New York, it was 2000. In Nebraska, it was 1986. So any well drilled before those times is undocumented. And it turns out even in Illinois, I did a study where I sent 5 geology students out to inventory every well in 9 townships in a rural area. They found 1,708 wells, and we did not have logs for 788 of them. So almost half we didn't have logs for, and we've been requiring logs since like 1963. So you can imagine in other states and other areas where maybe there's not a rule or the law was passed much later, there's many more undocumented wells on file than there are wells we know where they're at. And that's a problem, not only for someone trying to deal with the water quality issue, but even for the standpoint of safety and source water protection. Every one of those wells, especially if it's not sealed at the top, you see a steel casing that's right at the surface, or maybe it's been cut off below the surface and never filled in. People dump stuff in those. It's just like in the southern parts of Illinois and Kentucky and Tennessee, where there's a lot of karst topography and there's sinkholes. You drive on any country road or township road and you see a sinkhole out in the middle of a field or in a pasture. They've dumped old cars, tires, all that sort of stuff into these sinkholes thinking they're going to fill them in, not understanding that that's the conduit into the aquifer that's below, and they're a safety hazard and a source of contamination. So what we tell people is if you have an abandoned well on your property, you need to properly abandon it. Not only is it a benefit for you so that no one gets hurt, but if it contaminates the aquifer, or if somebody walks on your property and falls in and gets hurt or killed, you're going to be liable. And so I know in a number of states, the stormwater conservation districts have a program for cost-sharing proper abandonment of wells. They do that in Champaign County, where the U of I is. I know also in Iowa, their state legislature has a grants to counties program where they'll fund the counties to do cost share for either water quality sampling or for abandonment of wells. And so, you need to check and see what might be available. You're probably already aware of those things if they are available, but there's opportunity to both protect the aquifer if need be, or help folks take care of their abandoned well if they want to. Here's what happens. These are, again, the two pictures on the left are from the Washington Department of Ecology, and a guy fell 45 feet and was lucky enough to live. And you can find a ton of images of horses and cows and everything else that have fallen in wells and old abandoned wells that are just out there and not been sealed properly. These newspaper headlines on the right were put together by Harry Hendrickson, who used to be the groundwater protection coordinator for Illinois when we had such a position. And three of these are actually in Illinois. The bottom one's Springfield, which is where our state capital is. The top one is Galesburg, which is in western Illinois. And the second one is, I believe, Buffalo Grove, which is a Chicago suburb. And so, it happens all the time. Everyone remembers Jessica McClure that's old enough. Her rescue from a well in Texas was on CNN for about 18 hours, and it was the first, captured everybody's attention. And so it happens a lot more than people realize. These were all put together back in the late 90s, so it's not like that's the only times this has happened. The issue is people only hear about it in their local area. Why that is, I don't know, but I guarantee you the people in Springfield don't know about the person in Galesburg that died or in Buffalo Grove, because it just doesn't make it past regional media. Okay, so getting near the end here, what I want to mention about groundwater professionals and health professionals and some gaps, there are issues that come up. One, groundwater is more complicated than folks realize, and you really need to have an understanding of that. There can be multiple aquifers in one place, and so you can't look at, if somebody does a water quality set of samples in an area, it doesn't mean that all those wells are in the same aquifer, which means they could have very different chemistry. So you can't map all of that and just come up with, this area has this issue and this area has that issue, because it may be that the wells aren't comparable. There's also areas where there are dug or bored wells and there's really no aquifer. In Champaign County, we have the Mahomet Aquifer, which is a very large sand and gravel aquifer that supplies a lot of water to hundreds of thousands of people throughout the middle part of the state. But we also have a part of the county where there is no aquifer and there's dug and bored wells. And so you can't look at Champaign County as a whole and water quality analysis that are done and compare it. And so it's the issue of groundwater professionals who understand those things need to work more with health professionals who may not, and vice versa. There's certainly health issues, just like I found out last week from one of our county health departments, that Illinois allows lagoons for septic. And I had no idea. And I've been doing this for 30 years. And I was almost embarrassed that I didn't know that. But there's so few, I've never come across it. And that's just, but it's in the statute and it's allowed. And there are some places in the state where there are a few of those. So we all have a lot to learn from each other, so to speak. And the second bullet here, water well issues are not straightforward. I'm going to mention this. When I was asked to sit on a work group of a bunch of folks who were looking at issues related to private wells from all around the country. We all met at Johns Hopkins, and when we got our call to arms or whatever things we were supposed to look at, it was clear that the health professional who had developed the list had taken it from the US EPA's website. These are issues we have to worry about related to water quality in private wells, and they're not community water supplies, which is what EPA regulates. And so one of the things listed there were algal blooms, which, if you're familiar with the Great Lakes, Toledo, I think, and a few other communities up on Lake Erie have had algal bloom problems where it's affected water quality and they had to shut down their water system and all those sorts of things. But you don't have algal blooms in private wells. And so you can't just assume that private wells have the same issues as community water supplies. They just don't. One of the things that I come across a lot are groundwater samples versus drinking water samples. They're very different. When we're doing a study to look at groundwater samples, we flush the lines, we use an outside spigot that doesn't have any treatment on it. We let it run until we've looked at conductivity and pH and temperature, and it all stabilizes so that we're actually getting water that's coming from the well as the well pump kicks on, and it's really from the aquifer. That is one type of sample versus a drinking water sample, which comes from a kitchen tap. It matters whether you have lead pipes or copper fittings or treatment. You have a softener. All those things make a difference. Our lab, which Dan runs our public service lab, when a well owner in Illinois calls us and wants to get a water sample collected, he asks those questions. Do you have treatment? How old is your home? All those things so we can get a feel for, do we need to collect one sample or do we need to collect two or more? So for instance, if you have treatment, you have a filter and a softener, they'll try to collect one sample that's before those things so we can get a better idea of what the groundwater quality is, and then one after those things so we can get a better idea of what the actual drinking water quality is. And they matter. And so then when I do a study like that, if I publish the results and make the data available, someone can misuse that if they don't understand the difference. And that's my point here, I think. Yeah, dealing with well construction issues, I've mentioned that several times. It's just really leads to a lot of the water quality and especially bacterial problems that we see in wells. It's usually many times it's a well construction issue, and that's just the way it is. People don't take care of their wells. They don't understand why it's important that it's sealed. If it's cracked at the surface, what that means. You saw the home with the board on the top or the dug well with all the tin. That's not a safe way to have your well, just plain and simple. We don't have any information on treatment or bottled water. I was called by the New York Attorney General's office and asked if I could tell them what percentage of well owners in New York have treatment and what kinds of treatment. I went to our lab, and we actually collect some of that data for the people that actually send in samples to us if they have a softener or if they have a filter, any of those sorts of things. So as a surrogate, we looked at that, and what it told us, one is we probably have people who are actually have the wherewithal to want to get their water sampled probably are more likely to have some kind of treatment. We saw things like 11% had RO on their systems, or reverse osmosis, and there's no way 11% of all the well owners in the state or the country have RO. And there's just none of that data is available. And why that matters is because you could sample people's wells, and then someone looks at health effects or some of the cancer data and all those sorts of things, and they may look at that water quality for all the wells that were sampled in a given area and say, hey, yeah, we're seeing an increase in cancer in this area. As an example, it may be that half the people that had cancer weren't even drinking their well water. That's a question you have to ask. Or they're using bottled water, or they have some kind of treatment. So all those things matter, and I guess that's my point. And like I said before, we can all learn a lot from each other. If you're active in this arena as far as trying to reach out to well owners, you really should have a team that has both. And I'm trying to remember what my high arsenic example was. It's all perception too. We ran across someone in a county who thought they had really high arsenic, and they'd sampled about 100 wells, I think, and the highest value was 22 ppb. To me, as someone who's done a lot of arsenic research and looked at arsenic all around the state of Illinois, we would be tickled pink if a lot of our aquifers that had arsenic only had 22. We see 200, 250, 500, and so it's all perception. The standard used to be 50 until 2006, and then it was lowered to 10. And so understanding that variability and some of those things, I think having a team approach would help with that. And I honestly don't remember what the lagoon example was. Oh, no, I mentioned it already. That's not understanding that we have lagoons as septic in Illinois. All right, sorry about that. Okay, so I want to show this cross-section because it kind of makes the point I brought up earlier. I drew a red line here. If you look up at the top under the lithostratigraph section, you can see it says Cahokia Formation. That's a sand that's a recent alluvium. That means it was deposited by a current, river, or stream. And then as we go down, Illinois had a series of glaciations, and before the glaciers ever came here a million years ago, the white at the bottom is bedrock. That was land surface. So then we had a glaciation, and a receding, another glacier receded, another glacier receded. Each time, sand, silt, and clay get deposited in all these weird, complicated ways. And so where I drew this line, I'm touching 1, 2, 3, 4, 5, 6 different aquifers that a well could be finished in. What a well driller does is they start drilling, and especially in sand and gravel or unconsolidated deposits, they start drilling, and they know when they're drilling in clay versus when they're drilling in sand. And once they hit sand, they drill to a certain depth to see how thick it is. And if it's sufficient thickness, they might stop. So if you're right in the middle of that Cahokia formation at the top and you hit 25 feet of sand, you may have a 25-foot well to screen it from 21 to 25 feet. Or if you know you want a large supply, you may go all the way to the bottom where the Muhammad Aquifer, this is a Muhammad Aquifer cross-section, where this A is, and you could put a screen in that's 20 feet of screen or whatever, but you've got several hundred feet of water in your well if you want it. So just in this one example, your well could be finished anywhere from 25 feet to 350 feet deep. And that's the issue that you have to understand when you're looking at, especially if you're comparing data among wells, because in the Muhammad Aquifer, especially out like in the areas where I've worked, Tazewell, Logan, McLean County, and some of those areas, you see wells in all of these. You see wells that are 80 feet deep right next to a well that's 160, right next to another one that's at 260. And they have very different chemistry. They were deposited hundreds of thousands of years apart. They may or may not be connected. And so it's not one flow system. It's a whole group of them. And it certainly makes the situation more complicated, but it's reality, especially in glaciated terrain. So my take on all that is the best thing to do is to develop a relationship with your scientific surveys. In Illinois, we have a state water survey. We're the only one in the country. Actually, Oklahoma has started a water survey, but we've been around since the 1890s. And in every state, there's a state geological survey or a USGS state office. And those folks are probably your best bet for understanding the geology, hydrology. They map aquifers. They may maintain the well logs. In other states, in Wisconsin, DNR, Michigan, DEQ, Washington State is the Department of Ecology, or in some states, it's the Department of Public Health does all those things, like in Minnesota. And so it really depends on where you're at, and also if you're trying to do outreach to well owners or work with well owners, your county, obviously, many of you, I'm assuming, are with the county health department, but also your county or state level extension do a lot of outreach in rural areas. And depending on the state, I mentioned that earlier, may have a very robust outreach program where they're actually going out and doing trainings around the state and workshops for well owners. So they're a great resource for geology, hydrology, understanding natural water quality, if there's arsenic, those sorts of things. So that's what I would recommend. The more you learn about the geology and well types and those basics, the better you're able to serve well owners as well. So a little bit about the private well class, and I'll try to go quick. I know I've talked a long time. If you're not familiar, we have this website, privatewellclass.org. You can sign up for 10 lessons. You get one a week if you sign up that way. And there's also these multimedia lessons. We record every webinar. We've created about 20 videos that are on specific topics like what to do after a fire or what is an artesian well. And we've also started doing podcasts. We're a little behind there. We've got 3 of the 10 we need to do done. But there's a lot of information there that you can either share with well owners or use yourself. This is the front page. You can see on the lower left, learn by emails, where you can click and sign up for the class. The audio is a podcast, and the video on the right is the webinars and those other videos I mentioned. When people enroll in the class, this is what it looks like. We just ask for an email address so we can send them the lessons one a week, their first name and where they live, and that's really counting so that we can show EPA, which funds this program, that it has national reach. And so, we're not trying to be intrusive, but the only way to get the information to people is through their email. For every lesson in the class, there's a series of resources that we put together from other folks and other states. We try to be good about getting information from all over the country, not just in the north part of this country or the south part or whatever, but to provide resources that deal with a lot of the different issues there are. Just like water laws are so different in Illinois versus, say, Oregon or Washington, because Western water law is so much more restrictive and those things. And the goal of all of that is to teach well owners why their well is important, why they need to understand how it works, and to help them protect themselves from risk. And it's really valuable. in that respect, in that it walks through all the basics that a well owner needs to understand. Many just assume they're well safe, and if they're willing to go through this, it's not for someone who just has a question. And we get a lot of that where people are like, well, I just want to know what I should sample for. Well, we think you should take the class and understand all the issues related to your well. It'll help you ask better questions and understand what you sample for, why you need to sample for those things. As far as environmental health professionals, we've worked with NEHA early on. This has been around for about 4 years now, and early on in our evaluation, a lot of sanitarians and environmental health professionals who took our class commented that they'd like to get continuing education credit for it. Well, we reached out to NEHA, and now they're a partner on this program, and just on February 1st, this went up live. You can go to their e-learning center, and there's a series of free classes, and each of the 10 lessons is there. You can do each one independently, and total there were 10 CEs. And also the Association of State Home Inspectors is going to use NEHA's website, and home inspectors will get accreditation too, although I don't know how many CEs or exactly how their accreditation works. That just came about. But it's there, it's available, and it allows you to take the class if you haven't and actually get credit for it towards your credentials, assuming your state accepts NEHA credentials. And we plan to host workshops around the country this fall for sanitarians and environmental health professionals. I mentioned we're developing an assessment tool. It's meant to be something that you could use in the field to help a well owner understand what their risk might be or what the vulnerability of their well based on their geology and well type and what you see around their well. So there's a partners page and also a partner newsletter. I think I go to that here. Yeah, here's a partner resources page. If you want to sign up, it's really as an outreach partner. There's no obligation to anyone. It means you'll get notice of our webinars and other information, and we put out a newsletter once a month. We just started that, and towards the bottom you can see there's resources you can put on your web page. There's a flyer you can pass out to well owners, and there's a newsletter archive for the 2 newsletters we've just started. And I wanted to show that because if you go to the February newsletter, you can click where it says click here for more about this free online course. It takes you to one of our blog posts about the NEHA website and how to get there. And many of you, if you're either a member of NEHA or have went there for training before, already have a login, but you have to create a login. It's free, and once you do that, you can take those classes. So we need to take a few-minute break so that we can look and see what the questions are here. I've been talking a lot. So it says 5 minutes. It might be less than that depending on the number of questions we have. And then I think Dan and Chuck are going to join me and help with answering those. So if you'll just stand by, we will be right back. All right, so that was a little easier than I thought it was going to be. So we're just going to keep going. Here are the questions. Hopefully everybody can see that. Somebody be sure and text me if they can't. But the first question here says, I was told a landowner needed a new well because his current well is pumping sand. What does this mean? And the new well is drilled just a few feet away from the old well. What can happen when you have a sand and gravel well with a screen is either where they've welded the screen onto the steel casing, or if it's PVC, it's threaded, or in some cases it could even be that the screen itself splits, and so it doesn't protect from sand entering the well anymore. So as your pump pumps, it causes turbulent flow around the pump entrance, and if it's too close to the screen or if there's some kind of breach in your well, then your well will start to pump sand. And the only thing to do is abandon it or put a liner in it if that's possible, because sand is so abrasive, it'll ruin everything else in your system. Your pump will have to be replaced soon. It'll stop functioning efficiently. And so it's not that the aquifer isn't available or that, you could almost even, you could drill it just a few feet away because it's actually the casing itself has been breached in some way. Or it could be that the well is old enough and the water may be corrosive that it's eventually just wore out the screen. But whatever the case might be, it's that there's a breach in the well. And so when the pump pumps, sand enters the well and it comes up through the pump. And if you don't, like I said, you really have to replace it. You don't have a choice. Okay. So it says, do you test well water for free for chemicals used in the growing of corn and soybeans on farm fields? I'll let Dan answer this, but I mean we don't test for those in the first place. But those things are expensive to test for, and that's just the way it is my understanding.
Yeah, this is Dan. Can you hear me, Steve?
I can. Yep.
We test for nitrate would be probably the closest. We don't test for any pesticides like insecticides or herbicides. Yeah, they can be expensive to test for. Ours is not free any longer, but we do charge a small fee. I don't know what it would be like for other states, but usually you can get a bacteria and a nitrate test for not too expensive with many of the health departments. I'm not sure what all the different policies are there.
So the water in Illinois, the water survey and our public service lab until about 2006, I think, or 2008.
Yeah, about like that.
Any well owner in Illinois, private well owner, could get their water tested for free for inorganics and metals. And unfortunately, it's not free anymore. It's still pretty reasonable. But things for like, herbicides, atrazine, allichlor, all those things that I know they're expensive to test for. Back in the 90s, we used to do a lot of research looking at those in our shallow groundwater, and we had to pay other labs to do that work, and it was quite expensive. And I'm sure the costs have gone down over the years, but you'd need to talk probably to a private lab, or if your state has a state lab for your county health departments, they may have a suggestion too. It really depends on the state, as he mentioned. So, in the past, have you seen any records that indicate that some drillers used to just case off the overburden on the top of bedrock, set the bottom casing on top of rock without grouting the casing some distance into bedrock? I don't know that we would notice that as far as looking at the records. Most of the time, what we're using the records for is to look at the geology and to understand the relationship between the different units, the geologic units. And, we're not a regulatory agency where we're looking to see, that the drillers are doing their job right or those sorts of things. So I certainly haven't noticed that. It doesn't mean it doesn't happen. I know you mentioned casing off the overburden. One of the frustrating things to me is that there are drillers in northern Illinois who will blow right through 40 feet of sand and case it off into bedrock and drill a well that's 200 feet deeper than it needed to be because they're used to drilling bedrock wells. And so when they happen to be in a place where there's sand and gravel, they don't know what to do with it, so they just don't. And it's really a disservice to the well owner. You may have 40 feet of sand from 110 to 150 feet that would have been a very good, perfectly safe aquifer and well, and instead they've got a 350-foot bedrock well that may be high in some other natural contaminant. So, some of those things are frustrating. It's about driller education, too, and, there's certainly, in most states, again, not in Pennsylvania or Alaska, but in most states they have to be licensed and they have to meet continuing education requirements. I know here in Illinois, one of our geologists just went up last week and was one of the presenters at a workshop for drillers that was just for that purpose. So I'm not really answering your question other than to say I haven't seen that. Okay. If the well is 400 feet deep and the casing is only 60 feet, would there typically be more than one open aquifer open that would be producing water? And if so, wouldn't there have to be a seal between the two production zones so they're not mingling together? Or should the driller, as the groundwater professional, be setting more casing through the aquifer that would not be used? We're talking about bedrock here, so it's all solid. So it's like if when you're drilling through that, you're creating, say, a 5-inch hole. It stays open on its own. So it's not like you have to seal one or two off necessarily. Most of the time you have, especially in bedrock layers, you may have some that are aquifers and some that are aquatards, like a shale or, some kind of, I'm a good example, some kind of dolomite that's not fractured or whatever. But the bottom line is you're trying to take advantage of all the open interval because you're trying to find fractures. So you do have commingling. And in some cases that is a problem because the water quality is different. And I know, and I'm not the bedrock guy here. We have several other guys who do a lot more work in our bedrock aquifers, and I'm mostly sand and gravel. So I'm not the best person to answer this, but you do have issues where water quality can be different, and it does mingle, and it can cause problems. So But I guess my take on that would be that if you know that there's different water chemistry in those units, then that should be a consideration. And it's probably more of a matter of the driller understanding that or being educated on that than they're trying to do something just to save money or whatever. So they should know, but they may not. And that may be something that as a county health department, you want to make sure drillers know in your area where those things occur. And I would say your state geological survey or DNR, one of those groups I mentioned before, might have information, or in Illinois, the water survey, on the water chemistry in those different units to suggest where you might want to, where you might have to deal with that. Does radon affect groundwater? Boy, I might have to get back to you guys on that. It is an issue, but I don't know enough about radon to really give you an intelligent answer there. Dan, Chuck, you guys have?
I don't either, Steve. I know I've heard people talk about it, but I don't. I think maybe it's more of an issue in maybe the deeper waters that's set in the ground as opposed to surface water supplies. But I don't really want to say too much about it because I'm not really that educated.
No, and so one thing I should mention, one of the parts of our program that's not online yet is an FAQ, and we're making it searchable so it's easier to use. Every one of our webinars, and we do one a month, and we've been doing this for several years, not always one a month, but we've done a lot of them, probably 15 or 20. We get between 10 and, say, 30 or 50 questions, and we've kept track of all those. We've got groundwater professionals or health professionals, drillers, septic installers, other folks that are in our area that we lean on to give us answers to those questions. And by early this summer, we'll have a very comprehensive FAQ that will answer questions like this. If you'll email me, I will find out more about this issue, and I'll email you back and give you a response. So, and you can just email, if you go to the private well class, our email address there is info@privatewellclass.org. But yeah, I usually caveat that at the beginning of these presentations. I'd like to think I know a lot about groundwater, but every time we do one of these or I start working on something, I realize what I don't know. And so I'd rather find an answer from someone who is qualified and get back to you than and give you an answer that may not be quite right. So moving on, do you normally test for atrazine? We don't. And it really depends on the lab. We always recommend that folks use state certified labs, but that's not always, our lab is not state certified anymore because of the requirements that EPA has put on being a state certified lab, but we do follow all the protocols, blanks, duplicates, all those things, and there's a number of university labs that are no longer state certified in their state because of that issue. And so you might want to contact your state university. In Texas A&M, for instance, I know I just talked to those folks last week, and some of them may, but if you go to your state primacy agency's website, they'll have a list of state labs that are approved in the state, and they would be able to test for that. Anything else, Dan or Chuck?
No, that's a good answer.
Okay. I didn't cover actual well construction procedures for drilling new wells. Sure. In every state, the rules are different, and so that's really isn't an easy thing to do on this webinar or even to provide. You should go to your state agency, like if you're in Washington State, the Department of Ecology, and if I'm misinterpreting your question, let me know. But I drill monitoring wells, so I could walk through the process, but I guess I'm not sure what you're asking. Most of the wells that I put in, or used to put in, we don't really do it anymore, are 2-inch PVC monitoring wells so that we can take water quality measurements or water level measurements around the state for our monitoring programs. They're not actually wells that are being used for supply. But yeah, the procedure is very different depending on what type of aquifer you're in. If it's a dug or bored well, I just had a county health department here in Illinois send me pictures. They're using, I think it was Teflon tubing, like a 20-foot section of Teflon for a bored well rather than concrete slab or anything else, and I'd never seen that before. So there's just a lot of variety depending on where you're at and what your laws are. So there's really, anyway. Is Illinois working across state lines to collect data for modeling counties on geographic borders? So we have, obviously aquifers don't follow any kind of state boundary or county boundary or any of those sorts of things, or even a U.S. boundary. So what we've done, the Water Survey is doing some water supply planning. It's funded through the state, where we're updating some of our larger models, like in the Northeast Illinois region, and it actually does include things across state lines. Actually, part of the funding that we got in this last round, which allowed our modelers to update this model of basically the northern half of Illinois, we funded the Wisconsin office of the USGS, I believe, to collect data on the Wisconsin side of the line and provide that as part of calibrating the model. So we certainly like to do that. I know the USGS has a program on developing monitoring networks around the country for each state, and we've been involved in that. And I know we were one of the pilot states, and we actually worked with Indiana with our plan that we put forth, if you will, dealing with wells that are in the Mahomet Aquifer that crosses into Indiana. And so we do as much as we can. A lot of times, because of state politics and that sort of thing, no one's going to use Illinois taxpayer dollars to pay for sampling in Wisconsin, which is short-sighted, in my opinion, because if it's the same aquifer, we're gaining information that helps Illinois taxpayers, but it's the way it is most of the time. So due to the hundreds of various pesticides and herbicides that are in use today, what is your response to people who ask to have their water tested for pesticides?
I can
go ahead. Yeah.
I can try to handle that, Steve. It's a really good question because there are a lot of these out there, and they can get the testing can be quite complicated across different methods, different extraction procedures, and you might, if you say you want it tested for everything possible, you might end up spending $1,000 to test for this. My suggestion would be to look for what's common in your area. Another strategy would be to look at what's listed in the National Drinking Water Standards. I think you'll see atrazine, allichlor, 2,4-D, some common things. There's going to be a lot of other things too, but try to find out in order to keep your costs down, try to find out what's reasonable to expect in your area.
Hey, Dan?
Yes.
Would testing for nitrates or something like that be a screening thing to see if you're getting, runoff from a field or?
That's probably a good question for Steve too. I think
actually. So we've done a lot of testing, on especially shallow wells, and I did a project where we went into 3 counties in Illinois that are all dug-and-bored wells, so they're most at risk, and we sampled for pesticides and nitrate, all ag chemicals, and we found really no correlation between the existence of one, meaning you're going to find the existence of the other in a well. And that was really surprising to us, and it was done in like 96, so it's been a long time ago. But there was no real correlation, at least in dug-and-bored wells, which, they're most susceptible to surface contamination and all that stuff because they're shallow and they're taking water from typically the water table. But the only other thing I would suggest for that question is to, ask around what people are using. And a farmer may not be willing to share what pesticides he's using, but I bet if you went to the fertilizer or the ag chemical dealer, they might be able to give you an idea of what's being used in the county. And, a lot of those things are restricted use, or they require the person who's applying it to be licensed today. And so there's probably information available. I'm not sure where that would be, but there's got to be through a county office or a state office to find out what things might be most prevalent. And pesticides are a complicated issue. We know just like for atrazine, there's 7 or 8 daughter products that you can find, and it's just not clear how that's all going to work. So there's no good answer if you really want to be safe. There's certainly classes of pesticides, and some of the immunoassay techniques are cheaper if you can find a lab that does those, and they usually test for a class of pesticides. I believe that's right. Correct, you guys?
Yeah, I think so. I think sometimes what you'll see is, like you mentioned, there's metabolites and things that might cause similar responses in some of those tests. So it is a complicated issue, just like you said, Steve.
Yeah. That's not a lot of help for a well owner that doesn't want to spend $1,000. I realize that too. So with the screen issue, couldn't you drop a pipe with a screen on it into the well and hook the pump to the pipe rather than drilling a whole new well, which is very expensive? You probably could, depending on the size of the pipe and the original well, but it may also be that there's enough sand that's filled in the well that you're not going to get the screen down into that unit. I mean, there's a lot of issues. It depends on the water level, how prolific the aquifer is. In most cases, I'm imagining you'd want to just drill another well. It is more expensive, but it's probably, you won't have other issues down the road that you might have by trying to do that. And again, it may be that if it's a 5-inch well, could you drop a 4-inch well down it? Probably. I don't know that you'd find a lot of drillers who are willing to try to do that. There's certainly risks if the pipe isn't straight, or if the sand's actually coming in because of a welded joint that's gone bad and the pipe's been caved in a little bit, then all of a sudden your 4-inch pipe doesn't fit. There's just a lot of issues. So, they certainly are expensive. For states that require a well permit, it is up to the sanitarian to make sure the well is properly constructed. Every state has different regulations, but I would think there are some general guidelines like sealing with bentonite, making sure runoff is handled properly. That would be good information for all sanitarians to have. That's very correct. We should probably put that together for everyone. Because even in Pennsylvania, like Brian Swistock runs their well owner program at Penn State, and they have their state agency, Department of Environmental Protection, has guidelines, what they recommend drillers do for well construction, even for the type of pipe and all those things that kind of meet what other states' codes are. It's just drillers don't have to follow it, is the bottom line. And, ironically, some counties in Pennsylvania have passed their own laws that say that a driller has to be certified through NGWA, the National Groundwater Association, to drill in their county, as a way around the fact that there's no state law for licensing drillers in that particular case. There certainly are best practices for construction and bentonite and those sorts of things. We could probably put something like that together. We haven't. There's so many issues here even. Nebraska, their state agency, did a grout study back in the early 90s or late 80s where they used clear PVC, a see-through, plexiglass, I think, casing, and cameraed all this work with grout using different formulations of grout, and their conclusions basically are that you should never use liquid grout. It never stays in place. It seeps out into the formation. It leaves gaps along the casing, and in all honesty, it's something that makes a lot of people's jaw drop when they realize that, because it means every law needs to be changed around the country about grout, and what they recommend in the end is that when you put a well in, you should use bentonite chips. The kind that are natural chips, not the ones that are compressed, because they have the best, once they've been saturated, they seal the best and they stay in place. So, when I drill a monitoring well, I use bentonite chips, but a lot of the laws in the state, in most states, allow liquid grout, that you use a trimmy pipe and all those sorts of things. And, I'd say the science suggests that those maybe aren't as sealed as people think they are. So it's not something that I'm probably, it's a more complicated issue than just providing general guidelines, I think. But there certainly are things that we should recommend. And if we're going to expand our program, it's really meant for well owners into these other areas, like working with environmental health professionals, then we should be able to handle those. So I appreciate the question. That's my answer for today. So I'm going to knock this down one so I can do this. There we go. Have you noticed increasing frequency of domestic wells affected by road salt applied, in hills and intersections? What we do notice, having Chicago in our state, we see the shallow aquifer up there has shown a huge increase in road salt contamination. So much so that some of the shallow sand and gravel aquifers up there already passed the secondary standard of 250. So, but it takes that kind of concentration to really see a big difference. I don't know that there's been anyone who's really looked at the level of detail of an intersection, but we do see, as I said, my boss, actually the head of the groundwater section here, Walt Kelly, has done some research that's been published on this, and there's a really great map that shows chloride concentrations even increasing in the streams and rivers up there because of road salt. So it's certainly an issue, and depending on how urbanized and how often salt needs to be used, if they're shallow aquifers, they're likely showing increases in chloride. So it is a problem. Is there a general class of pesticides? Oh, going back to that question, if you want the information or Walt's contact information, again, just email us, and I'll make sure you get that, and he can get back to you with some of the actual data that's been collected and that sort of stuff. Is there a general class of pesticides that are common to check for? Dan, Chuck?
I'm not really sure. I mean, they used to say atrazine, so the triazines would be at least common in Illinois, but I don't know if that's any longer the case, and it really depends on your area, I would think. I don't really have a good answer there.
Yeah, you know, if you're up in Wisconsin and it's in a potato growing area, then it's a different class of pesticides that are being used versus, you know, all corn and soybeans versus cotton, you know, all those things. So I would think that someone in your state would have a better feel for that, and maybe even your state primacy agency, like in Illinois, maybe our state EPA would be the folks to ask. But if you let us know where you're at, we can certainly take a look at that too. I mean, you know, part of our job isn't to have all the answers, it's to help find the answers, so that's what we're trying to do. Okay.
Steve, with the county extension service, would they have information on that?
You know, they might. They would certainly understand, probably a good source of information on what chemicals are being used in their area, because they're working with farmers and, you know, best practices, backflow prevention, some of those issues. So they may have a good feel for that. Should a private well owner have the pump pulled to check the pump and screen at some point in the life of the well? Usually, you know, unless you're having a problem, one, you can't, unless you're talking about the screen on the intake of your pump, you can't pull the screen if it's a sand and gravel well. And maybe I'm misunderstanding. But if your pump should be fine, if it's a submersible pump, it's meant to last a certain length of time. It's interesting, Katie called a driller in, I don't know, 6 or 7 different states, and we spread them out all over the country and asked them a series of questions. And one of them was, how long should a pump last? And we got a range from 5 years to over 20 years. And again, we picked just randomly one driller in, you know, Washington State and Illinois and New York and Florida, and it was really interesting to see some of the difference in those questions. So as long as it's working properly, usually I don't believe you would ever pull your pump, and it's only when you start to have a problem. You know, if things are happening like your pump cycling on and off, that's not probably the pump's problem. That's something, a leak in your drop pipe, or you have a pressure problem in your bladder tank, or, you know, one of those other issues that cause your pump on and off switch to start working on overload, so to speak. So your pump's supposed to last, and it's supposed to be maintenance-free, as far as I know. Okay, I think that's all of our questions. So I appreciate everyone who's hung around for the whole time. And again, if you have any questions or follow-up, or even if you have advice for what we should do differently, please share. You know, we want to make this as good as for everyone as possible, and we're always open to good criticism as far as how to improve things. So I hope you take advantage of the class on NEHA's website if you're a credentialed sanitarian or environmental health professional. And I guess, yeah, with that, thanks again for your time.